Progait is an assessment, and it's an assessment of the way you walk and the pressure that you exert on the ground when you walk. It's suitable for a large variety of people. Commonly, people think that it's something for just athletes. Although it can be very useful for athletes, it's not only for athletes. It's for anyone who has pain in their feet, which may be related to the way that they walk or the way that they run. The types of problems that we commonly see are when we have muscle strains, when we have heel pain or pain in the forefoot, which someone experiences when they're stood on their feet for any period of time or when they take part in their chosen sport. They're the common problems we see. When you come for your Progait assessment, the first thing that will happen is the podiatrist will have a discussion with you. They'll find out a little bit about you, your history, and any activities you undertake. They will then find out if you have any current injuries or problems or any history of injuries. Then they'll begin an assessment where they'll have a look at how you're put together. And they will do this by taking a look at your lower limb. So it's a good idea to bring some shorts or some loose-fitting clothing so they can make an assessment of your hip joint, your knee joint, and your feet at the same time. The assessment will then continue, and they'll have a look at how you walk or how you run. They will put you on a treadmill to do this, and they will use some cameras to record you. The cameras will be used to record you from the front, from behind, and from both sides. So they can see what happens at particular times in the cycle of gait, of when you're walking or when you're running. Movements happen at quite a quick speed when we're running in particular, so it's very useful to be able to freeze time and to see what position certain joints are in at certain parts in the gait cycle. The podiatrist will put you on a pressure plate. They will take a certain number of samples of you walking over this pressure plate, which will record the forces that your foot exerts on the ground. This can be very useful for the podiatrist to understand the size of forces and how long those forces are there for, because it may be the case that their management plan is going to include doing something which reduces the size of these forces, the direction of the forces, or how often they are happening. Once you've had a thorough assessment, it's important that you have a management plan which is going to give you a solution for your problem, or perhaps a number of solutions. These solutions can include a whole host of different types of intervention. The common ones which we see are exercise programs, or orthotic therapies, or change in behaviour and activities, or changes of footwear. Podiatrists will be in a really good place to advise you onto the right thing for you to be doing to facilitate some healing if you've got an injury, or to reduce the likelihood of you suffering the discomfort that you perhaps presented with in the first place. If you need orthotic therapy, it's something we can provide on site. We have the ability to make customised orthotics on the day whilst you're here, and it's something that can go into your shoe straight away that you can leave with.